In this week, we're going to be looking at the brain as well as the postcranial axial skeleton, which is the remaining skeletal structures from week 1. So the first bone that I'll talk about is the hyoid bone. This is a unique and interesting bone. It's one of the only bones that does not articulate with another bone directly. The function of the hyoid bone is really to support the tongue, which is above it, as well as to support and suspend the larynx, which is below it. The hyoid bone is also going to be important when we talk about the respiratory system, the larynx, as well as the trachea and the pharynx in one of our later units. But we'll talk about it here along with the skeletal system because it is a bone in the axial or the midline skeletal structures or skeletal area. But just be aware that it does not immediately articulate or join with any other bone, and it is really just a supporting structure for most of the pharyngeal structures. Now we'll actually move into the rest of the axial skeleton. We're calling this the postcranial axial skeleton. So it's all of the axial structures excluding the skull, which we already talked about. This includes the vertebral column, which is really a bony framework of fused vertebra that protect and support the spinal cord, as well as offer structure and support to the rest of the body and helps to articulate the movable skeletal structures, which are the limbs or the appendicular skeleton, as well as the rib cage. So the rib cage is going to be the thoracic cage, which is really the articulation of ribs, specifically at the thoracic region of the vertebral column. So we'll talk about these structures and again, unique features that are found in some of these structures and some of the ways to distinguish some of the vertebrae from each other, as well as talk about what the function of some of the areas of the vertebral column are. So let's start off by talking about what the vertebrae have in common. What are the features that are common to all of the vertebrae, I should say. The first one is the vertebral foramen. This is the opening that allows the passage of the spinal cord. It's the central opening in each vertebra. This is what makes this a column or a hollow structure where the spinal cord can communicate through. Next, we've got the vertebral body. This is the anterior part of the vertebra. So this is the area that sits anterior to the spinal cord that's running in between this foramen. The vertebral body is usually just this thick, chunky part of the vertebra, especially of the lumbar vertebra. Then we have the intervertebral foramen. So this is better appreciated on a lateral or sagittal view. We can see that there's an opening in between each vertebra. And this is where the spinal nerves that are exiting at each segment can communicate from the spinal cord itself, which is running longitudinally through the vertebra. And actually exit between each of the vertebrae at each level, or between each of the vertebrae at each level. So we've got the intervertebral foramen, which allows the passage of the spinal cord longitudinally. We have the thick vertebral body, which is anterior to that foramen. And then from a lateral view, we can see that there's an opening in between one vertebra and the next in order for the exiting spinal fibers at that level to leave the spinal cord. Other features that are found in all vertebrae are the paired transverse processes. So the transverse processes are projections on either side, lateral projections. They're going to be important for attaching muscles as well as ligaments that stabilize the entire structure. We've also got a single spinous process, which is a posterior projection. The spinous process also helps to support the vertebral column as a whole structure with ligaments, but it's also going to be one of the ways that we can differentiate one vertebra from another. So it's shaped differently in different segments of the vertebral column, and those are some of the differences that we'll point out as we go along. We also have articular processes. So we have two articular processes that are on top and two articular processes that are on the bottom. So the superior articular process and the inferior articular process. And this is where one vertebra articulates with the vertebra above and the vertebra below. So this is what creates that continuous structure, which gives us a column-like or a hollow area for the spinal cord to travel inside is the continuous kind of linking or connecting of one vertebra to a next via these articular processes, two superior and two inferior. So now we'll go over some of the unique features to some of the different vertebra segments. So we'll start with the cervical vertebra. So there are 7 cervical vertebrae named C1 to C7, but C1 and C2 also have unique names. They also look very different from the other cervical vertebrae. So C1 is called the atlas. And C1 actually has an opening that is secured by some ligaments here to allow an upward projection that's coming from C2. C2, also called the axis, has that upward projection, which is called the dens, kind of sticking up from the top of this vertebra. And that is where C1 can rest on C2 and is articulated by the ligaments that secure the dens in place. So C1 and C2 stand out from the other vertebra, one in the way that they kind of fit together and they look very differently from the others, and 2 in that they're uniquely named, the atlas and the axis. C1 also has these superior articular facets. So this is where that first vertebra articulates with the occipital condyles. And the occipital condyles were these structures that are located on the occipital bone, one of the skull bones. And this is where we have that head-neck connection between the first vertebra in the vertebral column and the lowest skull bone, or the floor of the skull, which is the occipital bone. Let's move now to the thoracic vertebra. So we've got 12 total thoracic vertebra from T1 to T12. The thoracic vertebra has everything that all the other vertebrae have, but they have additional areas of articulation. They've got the costal facets. And the word costal is referring to the ribs, and this is the area where the corresponding ribs articulate with the 12 vertebrae. Remember I mentioned that the thoracic vertebra also have to articulate with the ribs on each side. So each has 2 ribs articulating, one on either side, in order to create that thoracic cage or the rib cage that we described a bit earlier. So we have the transverse costal facet, we have the superior costal facet, and then we have the inferior costal facet. So the way this works is that a vertebra is going to articulate, a rib is going to articulate, let's say, at the inferior costal facet of this vertebra, as well as of the superior costal facet of the vertebra that's sitting below. Likewise, a rib is going to articulate here at the superior costal facet of this vertebra. It's also going to articulate with the inferior costal facet of the vertebra that's sitting on top. So again, we have this really reinforced connection between each level of the vertebra, as well as each of the corresponding ribs at that level. And then finally, the transverse costal facet is going to be an area of articulation for the tubercle of the rib. And we'll talk about what the tubercle is. It's basically a bump along the neck of the rib. Next, we've got the third segment of vertebrae. We have the lumbar vertebra. These are 5 vertebrae in total, so L1 to L5. A couple of unique things here about the lumbar vertebra are that they are much thicker. The bodies of these vertebrae are much thicker. I'm sure you'll be able to appreciate this when you get into the labs and you start actually touching the vertebra, but the thickness of the body is significantly greater for the lumbar vertebra. And that is owed to the fact that the lumbar vertebra is where we have the most weight bearing of the entire vertebral column. We have the abdominal organs here, we're getting down to the lower extremities, and so there needs to be a little bit more support along the lumbar region of the vertebral column. I'm going to go back to the thoracic vertebra here just to point out some other features that are unique that are going to help you distinguish thoracic vertebra from some of the others. One is that they have this downward, almost hook-like spinous process. So the spinous process of the thoracic vertebra are almost pointing downward as opposed to pointing straight back like some of the other vertebra do. Another feature is that they have a heart-shaped body. So if you look kind of closely here at the body, you'll notice that it has a heart shape. And you'll see that a lot clearer on some of the actual vertebrae in the lab as well. Lastly, here we have the final segments of the vertebral column, the sacrum and the coccyx. Now the sacrum is 5 vertebrae that have been fused. These fuse throughout, early adulthood, anywhere from teenagehood to early adulthood, 18 to 30 years. And so we've got this single structure, which is really a fusion of several different vertebrae into one structure. Some of the structures here on the sacrum are the sacral canal. So because this is a fusion of vertebra, we still have that vertebral foramen, which is traversing longitudinally through these vertebrae, and that actually creates this canal or hollow structure, which is called the sacral canal, this communication here. We've also got the auricular surfaces, so the lateral surfaces where the sacrum articulates with the hip bone. So remember, the sacrum is a central structure in the hip area, in the hip, between the hip bones. And so it has to articulate on either side with both halves of the hip bones. Now the hip bones are actually a part of the appendicular skeleton, so we'll talk about them in one of the later units, but within the middle of the hip bones, we have articulation with the sacrum. Next, we have the sacral hiatus, which is basically just the exiting of that opening of that sacral canal, where some of the terminal fibers can leave or exit through that hiatus. Other features, so if we flip the sacrum around and look at it from an anterior view, what we were looking at it on the previous slide was a posterior view. And if we look at an anterior view, we can see some of the other unique features to the sacrum. One is the transverse line. So these are lines of demarcation which just show where these were once individual vertebrae. So just lines showing where they were fused. Then we have the sacral foramina, which are openings on either side of the transverse lines. And these again are small openings or perforations which allow the passage of some of the terminal fibers of the spinal cord, okay? The last structure, or the most terminal structure of the vertebral column, is the coccyx. This is consisting of 3 to 5 fused vertebrae as well. Now the 3 to 5 here is because there's a bit of a variation here from anatomy to anatomy. So you may see 3, 4, or 5 vertebrae, but they all fuse to form an individual structure, which is called the coccyx, sometimes referred to as the tailbone. Now the coccyx is really a remnant of the tail. So when we were developing in utero, we developed with a traditional tail like some of the other animals in the animal kingdom. But by the time we are born, that completely atrophies and disappears, and we aren't born with that visible tail. Now some rare instances do occur where we have fetuses or infants born with the persistence of this tail. We call this an atavastic tail, which is really just the persistence of a part of the coccyx structure. Let's move on to the sternum. So the sternum is the anterior anchoring bone of the rib cage, of the thoracic cage. It's sometimes called the chest plate. So it's that flat bone where the ribs eventually articulate anteriorly along the midline. Some of the features of the sternum are the jugular notch. So there's a single jugular notch right in the center of the superiormost aspect of the sternum. On either side of that foramen, of that notch, we have the clavicular notches. So this is the area where the clavicles articulate on either side. We'll talk about the clavicles as a part of the appendicular skeleton. So basically the collarbone or the clavicle articulates to the rib on either side at the clavicular notches. Now the sternum has 3 distinct parts to it. So the top part that we were just describing is called the manubrium. The body, or the middle part of the sternum, this entire portion here, is called the body. And then the very small tip, or this distal projection, is called the xiphoid process. There's a point of demarcation between the manubrium and the body. This is called a sternal angle. The sternal angle becomes of particular importance in terms of a landmark. It's a clinical landmark. It's going to be a point of reference for clinicians and surgeons. A lot of things happen at that level of the body. So we have the arching of the aorta posteriorly. We have the emptying of some vessels into the heart posteriorly as well. And there's just a lot of activity happening at that angle, at the sternal angle. So for example, surgeons will determine whether or not the heart has been injured if there's a stab wound to the chest above the sternal angle or below the sternal angle. And that can be easily palpated through the skin. So we can kind of determine how low or high we have injury, whether or not that, that weapon would have pierced the heart depending on where it pierced the skin in reference to the sternal angle. So really important clinical landmark. And it also happens to be the connecting point between the manubrium of the sternum and the body of the sternum. Let's move on to talk about the ribs. So the ribs also have different parts. We've got the head of the rib, which is the first part of the rib, essentially the rounded projection that articulates with the vertebra. Then we've got the neck of the rib, so the smooth area in between the head and the body. And then the rest of the body, the area that actually curves around, forming that rib cage-like structure, is called the body or the shaft. There's also the costal tubercle. So I kind of alluded to this structure earlier. It's a kind of bump along the neck of the rib. This is where the rib articulates with the transverse costal facet of the vertebra at that level. We also have the costal groove. This can be appreciated from an internal view. So if you're looking at the inside of the rib, you'll see a small groove along the inferior border of each rib. This is a groove that demarcates where vessels run. So some of the intercostal vessels, they kind of put pressure along the ribs, and as the ribs mature and become more solid, they somewhat erode because of the pressure of the vessels that are running in that area. And so this creates a groove over time, which is called the costal groove. Lastly, we have the costal cartilage, and the costal cartilage is simply the articulating cartilage between the sternum anteriorly along the midline and the corresponding ribs that are articulating as well. So there's not a direct or immediate connection where there's bone to bone between the rib and the sternum. Rather, there's an extensive amount of cartilage that helps to bridge that connection between the sternum and the rib. And this becomes really important as a function of respiration. We'll talk about this when we get to the respiratory system, but it's going to allow or facilitate the rise and fall of the chest, which allows us to expire and inspire or to breathe, okay? So if there was bone-to-bone connection, the rib cage would not be as malleable or as expandable as it is. And so that cartilage really provides the room for the rib cage to rise and fall with respiration.